Hello and welcome to AACD Central. My name is Dr. Jack Ringer. I'm a past president of the AACD and an accredited fellow. Today's topic that I'm going to talk to you about is titled The Bookends of Comprehensive Aesthetic Dentistry, Consultation, Case Acceptance, and Maintenance Requirements. What is the ideal scenario for creating predictable and successful comprehensive aesthetic therapy? Well, we hope patient contacts our office, and then we schedule a consultation appointment, that very important appointment, that first impression that you need to make with your patient and your staff needs to make. Assuming that the patient wants to continue in your practice and have you be their provider, you'll bring them back and start gathering information. And that will be the diagnostic workup. And most of us know how to do this and various techniques, but that needs to be carried out. Once that's all been done, a treatment plan is going to be created, okay? And you will go through the various options with your patients, and hopefully after a nice discussion, the patient then accepts one of those plans. So therapy will be accepted. And then off you go and do the treatment. Well, that should create success, right? Well, maybe, all right? Because in order for there to be predictable success, we need to establish a very specific and structured protocol, starting from the consultation appointment and carried out all the way through to completion. What this program is going to start off showing you is the 10 workflow modules that we go through, all of us, just in our minds, or we are structuring it. But these are the modules that are really required in our practices to complete comprehensive aesthetic therapy, to be successful at that. The first module would be diagnostic and treatment workup. That would be followed by interdisciplinary communications with your specialists, your lab technicians, etc. Once all of that's been done, the patient has made all necessary communications and appointments with specialists, a treatment plan's been accepted, and you're going to start the work. Well, there's going to be tooth preparation, design, followed by impression techniques, and then prototype restorations. And I use that word prototype primarily because I'm not an advocate of saying provisional or temporary, as prototype is actually what we're doing, and it sounds more sophisticated for our patients. It just sounds better. So once we've gone through those 5 steps, from doing the diagnostic workup, the interdisciplinary communication, followed by actually preparing teeth and impressing them, and then creating the prototypes, we now have to figure out what materials we need, okay? So that's a module our minds have to go through. Following that, we have to communicate with our laboratories. We have to let them know the type of materials we'd like, what type of restorations we need, whether it be onlays, veneers, inlays. The laboratory will create all the restorations and deliver it to us. And once they're our office, we have to now go through the cementation fundamentals. We have to understand our cements. We have to understand or evaluate if our restorations fit properly, are optically correct, and then we would place these in. At this point, the actual clinical aspect of our therapy is completed, but marketing becomes a very important strategy with this whole therapy process, because it's one thing understanding all of this, but if no one is coming into your office to do it, well, what's the point? So we have to master marketing strategies in our practice. And the very last one is maintenance. We want to make sure that our patients are taking care of all that hard work. So as years go by, they're going to have predictable success with them, both biologically, functionally, and aesthetically. In this program, though, our module today, we're doing consultation, case acceptance, and maintenance requirements. We're not going to discuss the other modules. So we call that the bookends, right? It's from the beginning till the end. The first part is we're going to discuss consultation and case acceptance, and that falls under the category of diagnostics and treatment workup. Diagnostic and treatment workup has 5 different steps involved. As you can see, we have communication, clinical examination, aesthetic evaluation, aesthetic design, and treatment plan. Communication, being successful in that area, falls in line with our consultation. If we're successful with our communication skills and have the right tools to communicate with our patient and our staff, and for that matter, even our interdisciplinary team, that will lead to our next area when a patient can accept that therapy. If we fail in that initial consultation, we're done. The patient is going to get up and go somewhere else. So we're going to go through the consultation parameters in a couple of minutes. Case acceptance would incorporate those last 4, because you have to do a clinical exam, you're going to have to do an aesthetic evaluation, you're going to have to do an aesthetic design followed by the treatment plan before there can be any case acceptance. So those 5 areas will take care of our consultation and case acceptance module as the first bookend of our presentation.